South Birmingham PCT is tackling inequalities in male life expectancy across Birmingham with a cardiovascular risk assessment service known as the Heart MOT. The PCT is engaged with Lloyd's Pharmacy and independent community pharmacies to deliver an easily accessible service that enables early identification of men with high-risk factors.
The Heart MOT was launched specifically to reach out to the people who don't usually see their GP, who would not normally have had their risk assessed. We want people to feel able to have a risk assessment in an environment which is easily accessible, and by doing that risk assessment get them into an effective treatment plan at an earlier age than they would otherwise.
There's good published evidence that show that community pharmacies are very good at accessing the well public, really. 94% of the public visit a pharmacy each year. In terms of the number of pharmacies, well, we've got 71 in NHS South Birmingham. You're never more than a mile from a pharmacy. They're always open. You don't need to make appointments. So when it comes to choosing where you're going to put a cardiovascular service, that's sustainable in the longer term and can fit into a broader strategy, you'd be silly not to think of community pharmacy as one of the areas to do that.
Well, the biggest challenge implementing the scheme was to take an even-handed approach towards community pharmacists. Lloyd's Pharmacy had a reputation already for doing this kind of work, and they were willing and eager partners. But clearly we don't want to make enemies, we need to build alliances across the patch. So there was the matter of drawing in independent community pharmacists.
Typically in a month we deliver about 10 healthy heart MOTs. A typical screening session is made up of about 4 components. First part is the blood pressure reading, second part is the cholesterol test itself, where it generates cholesterol reading, and the third component is lifestyle advice, which is tailored individually to that patient, and finally a score of the cardiovascular risk assessment score, which is basically the patient's risk of developing cardiovascular disease in the next 10 years.
This particular service was thought of in the late summer 2006, and we managed to get it set up very quickly with Lloyd's Pharmacy as the first provider in about 3 to 4 months. And with someone like Lloyd's it was relatively easy in terms of rollout, because they already had a lot of trained staff, a lot of the infrastructure in place to do relatively quick rollouts.
The service was very easy to implement. Training was required of all pharmacists and staff as well, or HCAs. South Birmingham PCT did conduct 2 training sessions, whereby we went through a typical cholesterol test, went through the equipment and how to actually perform the cholesterol test itself.
Effective marketing was fundamental to this service because it was all about a change for people to go to their pharmacies to actually get health checks done that they may have previously chosen to go to other areas, but actually we were trying to target a particular group of men who we knew wouldn't access any service. We designed the campaign to really target them and their partners to see and identify with the Heart MOT service. So we promoted it in a range of ways through, for example, targeted mail drops to areas where we knew there were issues around deprivation and heart disease, as well as advertising vans and general radio advertising. And there's also a Heart MOT website where we advertise all the local pharmacies on there. We couldn't have run this Heart MOT scheme without all the pharmacies really involved and on board. We've got some fantastic local pharmacies in our area who've really pulled the stops out to market and promote this service together with us. We also benefited from the capacity of Lloyd's Pharmacy to actually produce the marketing materials on behalf of all the pharmacies, which was a real positive.
The mass screening which we used was a separate batch of tests from those where people walked into the pharmacy. They were 9,500 tests we conducted in about 7 months, and rather than have them in the pharmacy, they were delivered at places like Aston Villa Football Ground, Birmingham City Football Ground, the Birmingham Science Museum, and in places which were easily accessible to the general public at times when they wanted it, evenings and weekends.
Quality of the service is really important to us, and one of the things that we do is we carry out an annual mystery patient visit to each pharmacy in a supportive way, and the pharmacies welcome this. So what that means actually, we have a mystery patient that will go into the pharmacy and will assess the service all the way from the point they walk through the door to the actual results of the test that they receive. And that's been really useful for us. I mean, we did it quite early on when the service had only been running a few months, and we found that there were access issues. You know, so we were able to iron out those teething problems at an early stage.
Well, the advice I'd give to other trusts is to realise that community pharmacists are a very significant resource out there, and that they're very willing and indeed competent to do some of this outreach risk assessment work.
If you're setting up a service covering around 25 pharmacies and you were buying in all the hardware, all the IT, all the marketing, all the training, and actually paying the providers as well, you know, in the first year, which would deliver around 2,000 clients screened, you would pay about £100,000. And what do you get for that? Well, I suppose at the end of the day, every time you do get someone into the NHS, get them onto treatment, then, you know, potentially you're preventing a heart attack down the line. So it's actually a very cost-effective way when you're working out in terms of patient costs of actually getting people onto treatment in the longer term.